Hello everyone, good morning. I am here with Dr. Golio. Today we have the pleasure of being with him live so that he can explain lots of questions that we get from patients from all over the world who want to inquire about having a hair transplant and don't know as much information as they would like about it. So today we're going to clarify all of these things. So
Yes,
thank you for being here.
Thank you. Thank you for having me.
All right. So first and foremost, we're going to read through the questions that we get in on a weekly basis on the phone. So first and foremost, can you explain and touch up on hair loss, what it is, why does it happen, and how it just, the whole situation?
Sure. So basically what typically happens with hair loss is the following. You'll have a man or a woman who has a genetic predisposition towards it. And this comes typically inherited through the mom's side. So the X chromosome that you're getting from your mom, in men, they only have one X chromosome, and that's the one that carries the hair loss gene. So what happens typically in young men is when they get to about 18 or 19, they'll hit their secondary androgenic phase, meaning that the male hormone testosterone is now even more so, and that's when they develop the secondary masculine characteristics, the strong brow and the heavy beard. And what typically happens at that point is the testosterone hormone that they have circulating in their body is now converted by an enzyme called 5-alpha reductase into a hormone called dihydrotestosterone. Okay. Dihydrotestosterone is the active hormone. What that does is it circulates around your body and makes your muscles stronger, but it also has the detrimental effect of causing the hair that's programmed genetically to be lost to start to go into that senescent, meaning that sleeping phase. Okay. So that's when young men will notice, and some women will notice, that their hair starts to thin a little bit, especially in the temporal areas. So the first place that young men will see it is they'll start to see a little bit of recession along the temporal region. And this will progress over time depending on how your genes are. Mm-hmm. And what that'll happen is you'll have an idea of, you'll see the hair start to gradually recede backwards.
Okay. All right, and how does this affect women as well?
Well, women typically will start to notice this when they become perimenopausal or postmenopausal. So you no longer have the benefit of the estrogen effect that you have. Right. So estrogen is a very potent hormone for women. It's very important for fertility, and it's very important for your hair, right, and your skin. So what happens is when they hit that postmenopausal phase, if they have that genetic gene to have that genetic predisposition to losing their hair, they'll notice some hair thinning. Okay, and typically they'll notice it in the same areas as young men will notice. Yep. They'll get some of that temporal thinning. They'll get some just thinning overall. So those women are also affected by this, but at a later age. It's a different period of time. And what we can do for them is the same thing that we do for young men. We can actually transplant hair from the back, which is genetically programmed to not fall out, to the front.
Okay, and they can get it in their eyebrows and whatnot?
They can get it in their eyebrows as well. You can, if you've had any scars from previous surgery, such as facelifts, we can because in the old style of facelifts, women would typically lose the hair in front of their ears, which was a dead giveaway that you had surgery. We can now transplant that back so it looks very natural. You'll get that pre-tragal hair again. Okay. And that's a big thing that most people don't even talk about. But.
Yeah. What about postpartum?
It depends. Usually, I would say in those instances, if you do have some hair loss, it's probably more from just the hormonal things that are going on. That hair will likely come back.
Come back. Okay. Second question that we typically get is about the consult process. How does it work? Would everybody be a candidate? Who's not a candidate for this?
So basically when you come to us, what we want to do is we want to go through a full history and physical with you. Why do we want to do that? Because this is a medical procedure. It's a surgical procedure, so we have to go through your full medical history. Do you have any allergies to medications? Do you have diabetes? Do you have hypertension? Have you had any surgeries before? Do you have any allergies to medications? All of these things are very important because we want to be able to make sure that everything is tailored specifically for you, right? So those things are very important. For example, if you have diabetes, that can increase your risk for infection. So we want to make sure that your diabetes is optimized. What we'll check is your hemoglobin A1C, which is the molecule that tells how well your blood sugar is controlled over 3 months. And we want to optimize that to be less than 7 to minimize risk for surgery. If you have high blood pressure, right? That can cause excessive bleeding intraoperatively. So we want to make sure that you're medically optimized for that. So we shoot for having your blood pressure less than 120/80. Do you have any allergies to medications? Have you had surgery before that you had any issues with anesthesia? So we want to know all of these things to allow for you to have the best outcome and the best experience with the lowest amount of risk possible.
Okay, what about people who smoke, vape? Very
Smoking
common.
and vaping, yes, very common. So those are really problematic, and here's why.
Okay.
So when you smoke, you breathe in carbon monoxide and nicotine, okay? Those two are really not great for your healing, and here's why. So nicotine causes vasoconstriction. What's that? It means less blood flow to the area. When you have less blood flow to the area, less chance of the grafts taking.
Yeah.
The other issue is with smoking is carbon monoxide. Carbon monoxide binds irreversibly to the hemoglobin molecule. This is the molecule that carries oxygen in your body. Okay, your body can't get rid of it. It has to make new hemoglobin. So when this occurs, we tell our patients to stop smoking to allow enough hemoglobin to heal well. Otherwise, you put the whole transplant at risk.
Yeah.
Right? Those two things, especially vaping has nicotine, sometimes it has carbon monoxide. Those are two things you really should try to stop at least 1 month prior.
1 month? Okay.
Yeah.
Another common question that we get is the extraction process. How does it work? Will there be scars? Are they going to look bald in the back after they have it done?
Okay, that's a great question.
Okay.
So typically what we're using now is something called follicular unit extraction. This FUE process has evolved over time. What we're doing is we're taking out each follicle individually.
Okay.
Okay, and that becomes with a microtome that's less than 1 millimeter in size. So that is beneficial for two reasons. One, the scarring is virtually non-existent, number one, and number two, you're pulling out the whole follicle. Okay, so we're able to take out the follicle, not have to manipulate it at all, when we transplant it, which is very critical. The less manipulation, the less trauma to the follicle, the better graft survival, the better graft take, and the more likelihood is that you'll have less shock loss.
Okay.
So these are all things that are very important. So what we'll do in this process is we'll take out each follicle individually. Now, something unique about hair follicles, they're not all the same. There are some with 1, 2, 3, 4, and sometimes even 5 hairs. So what we'll do is, at Hair for Hair, we'll take out each follicle, and then we'll examine them to see which ones are which. So the hair follicles that have 1 hair in it only will go for the front, 1 and 2s. The hair follicles that have 3 and 4 hairs per follicle will be more for the back to give you the volume that you need, right? So we try to customize it down to the follicular unit where the follicles are going. If it's 1 or 2 hair units, they'll go in the front. 3 and 4, they'll go in the back.
And patients have creative control of what they want their hairline to look like?
Yeah, so what we'll do is one of the things we want you to do is we want to go over with you, and that's why it's important that we talk to you prior to surgery, is to determine what kind of hairline you're realistically looking for, right? We want you to have the best result, most natural result possible. So what we'll do is with the patients when they come in, we'll sit down with them and we'll go over and we'll draw out a hairline preoperatively and say, this is what we suggest, what do you think? Or they'll say, this is what I had in mind. Can we do this? And we'll talk to them and say yes. So someone who's 65 years old won't get a hairline of a 20-year-old man, but we'll make it more so that it looks good, right?
Okay.
The idea is to individualize the whole process so that the patients will have the best result possible, most natural looking. The idea is not, you don't want to look like you had
A hair
surgery.
transplant.
Exactly. You want to look like you look good, that you've always had this hair like this. This is what you naturally had.
Okay, and in terms of pain, what can they expect?
The pain is a very subjective marker, right? Some people don't have any pain at all. Some people are very sensitive to pain. So it's hard to say. With this procedure, though, the pain is really minimal because we're anesthetizing the area with short and long-term acting anesthetics. So there's really no pain during the surgery. Okay, you may notice a little discomfort. You'll always feel pressure because the medications that we use can't get rid of the pressure sensation, but pain is virtually non-existent with this procedure.
Okay. We also get questions about post-op. What can they do in regards to maintaining results, especially for patients who don't live nearby?
Right. So post-operative care is really critical to ensuring the success of your hair transplant.
Okay.
Right? So this is an investment in yourself. So you want to invest in your recovery as well. So you want to be able to take off some time. Don't smoke. Don't exercise for the first couple of weeks. Really, you want to ensure maximum graft survival. And the way we do that is we tell the patients, don't touch the area. We'll bring you in the next day if you're around to show you how to wash your hair when the time to wash your hair is. We'll also tell you don't do any strenuous activity. No heavy lifting, no strenuous activity, no exercise for at least 2 to 3 weeks. Okay? Don't touch the follicles. Remember, this is transplanted small follicles. They're microscopic, really. And sensitive.
Yeah.
So, and it's a transplant. We're moving one thing to another. So it takes the time to heal, right? So you really want to make sure that you give yourself the time to get better.
Okay. And lastly, one of the common questions that we get is, how can I ensure that I'm going to enjoy these results? Are they permanent? Would I have to come back?
So basically, a lot of this depends. Yes, they are permanent. Okay, we're taking hair and we're transplanting it from an area that genetically it won't fall out.
Okay.
Okay, so those hairs are permanent. Now, how do you need 1 procedure versus 2? That depends on your level of hair loss. So there's a Norwood scale that we have that many men have looked at already when they're doing their research online, and they'll sit down and they'll try to figure out, am I a Norwood 1 through 7? Okay, so based on your Norwood scale, we can determine approximately how many grafts you'll need. And it also depends on the donor area. Some men have an abundant donor area, and some women have an abundant donor area, and some men don't have as generous a donor area. So those patients will try to catch it with we'll match it up with the Norwood scale and your donor area. Okay. Typically, younger people who have a mild recession will need between 1,500 to 2,500 grafts in the front. People who have more recession, who are Norwood 4, 5, 6, 7, will need significantly more. So they could be upwards of 3,000, 4,000, maybe even a second round of an additional 1,000. So those patients may need more than 1 procedure. Okay? So it varies.
And in terms of transplant, how it works for men and women, is there any difference between what women can expect and what men can expect in terms of healing? Yeah, no,
the healing's the same, but for women, we try to particularly take care. Men really, especially today, with the hair fashion, they don't mind being shaved. What we'll do for women is, in particular, we're very sensitive to women's needs. So what we'll do is we'll make sure that we only shave a small, thin strip, so it's camouflaged behind your natural hair. And that way, you can come in, get your hair transplant, and look like nothing happened. Right? That's what we really aim for.
Okay, perfect. These are the most common questions that we always get from our clients, from our potential clients on a weekly basis. So we thank you all for submitting your questions. Thank you for being here today.
Oh, thank you. My pleasure.
Thank you for watching. Thank you for tuning in. If you ever have a question, you can always write to us through DM. You can call our office. You can always leave your number in the live comments so that we can call you and set you up for a consultation. It does not hurt to go ahead and get this information. And like we always say, if you love your money, put it where you can see it. We want you to feel confident.
And this can change their life. This is really, this changes people's lives.
It really does.
They come in, today, especially since we're on camera all the time and not even realizing it. You're on the phone, you're on Zoom, you're on all these other platforms, you're on Instagram. People don't realize how much they're on camera now, and that's so important. Right? It really will boost your self-confidence and your self-esteem to heights where people now come back and tell us, hey, Dr. Golio, I got a new job, I got a new girlfriend. Their life changes dramatically from this. So,
and really quick before you go, people always ask, can I add drops or something to my hair to make my hair grow without having to get a transplant?
Well, so it depends on what level of hair loss you have, right? So the hair enters, there's 3 different stages of hair growth. So when you reach that dormant phase where the hair has gone down and shrunk down to what they call vellus hair, fine hair, it's very difficult to wake that hair back up. Okay? However, if you're in the process, you can take finasteride right? And you can take minoxidil. And those two things, low-dose minoxidil orally, not the topically, the oral formulation. And those can really help additionally to help some of the hair grow back. It doesn't necessarily, the hairs that are already in the dormant phase, in the vellus phase, you know, the chance of those coming back are minuscule.
It's typically why people stop using it.
Yes, right, because I didn't notice any difference. Well, that's because the hair has been asleep for 5 or 10 years.
Right.
So it's very difficult to get those back. However, the other hairs that you have that are thinner and smaller, but are still present, that you can see, those will grow thicker and stronger.
Okay.
Right? But it also helps to have this as well because here's one of the other important things about hair loss. When you get a hair transplant, that doesn't mean the hair behind the transplanted area won't fall out.
Right.
Right? So if you're on these medications, right, if you're on the minoxidil and if you're on the finasteride, or Propecia is what they call the name brand, it's very important to realize that you need to keep taking these. Right? You don't want the hair, we're designing a hairline for you with the hair that you already have present. If you stop taking those medications, the rest of that hair will fall out.
Right.
Not the stuff that we transplanted, not the follicles but the other follicles that are programmed to fall out will fall out if you don't take that. So, you know, that's one thing you don't want to do. You're making this investment in yourself. Continue to take the medications that you've been prescribed.
So you suggest the PRP that we do here?
Absolutely.
After
That's a great. So for patients who want additional, like a turbocharging growth, PRP is super.
Okay.
Right. We're taking your blood and we're spinning it down, and the plasma we found has very potent growth factors that can really turbocharge the growth of hair follicles. So what we're doing is we're offering that as well. So we'll tell the patients, come on in and we'll take out that blood, we'll spin it down, and we'll get that plasma that has all those growth factors in it, and we'll inject it. It's your own, it's very safe, natural, it only takes a few minutes. And let me tell you, the results are fantastic.
Yeah, I mean, everything that we do here is from you to you. So
Yes.
you have nothing to worry about.
Exactly.
That's why we also don't, you can't donate hair if it's not from yourself.
No. So yeah, very important. Sometimes we'll get questions, you didn't ask me this, but sometimes we'll get questions of patients, hey doctor, can I use the hair from my son, or can I use the hair from my brother? No, because your body will reject that. You have to use your own hair. But that's the beautiful thing about this process. We're using each individual follicle, okay? And that's really what makes all the difference.
Perfect. All right, so we snuck a couple more questions in there. Thank you so
You're
much
welcome.
for
My
answering
pleasure.
everything. It's a pleasure to have all of you on here today, watching us and learning with us. We look forward to seeing you. Please book your free consultations. Enjoy these promotions that we have going on. We look forward to seeing you soon.
Bye-bye now.